Good afternoon, and thank you for joining us at today's COVID-19 media briefing. Go ahead, Mayor Tory.
Well, good afternoon. I want to start by acknowledging that today Municipal Affairs Minister Steve Clark announced on behalf of Premier Ford that the City of Toronto would be receiving an additional $95 million to help with city shelter costs related to COVID-19. This is very good news for the City of Toronto. This funding, announced today, will go towards the more than $663 million the City of Toronto is spending this year to safely care for and shelter our homeless population, to provide for an expanded shelter system with proper physical distancing and other COVID-19 protocols, and on outreach and support for our homeless residents. This is consistent with what we said from the beginning, which is that we wanted to set a very high standard indeed for caring for our most vulnerable populations throughout the course of the pandemic. Coupled with last week's announcement by the province of an additional $91 million in funding for the TTC, plus $164 million for this municipal operating budget support for this year, this means that the Ontario government has now committed a total of $350 million in new relief funding since the passage of the city's budget just 3 weeks ago. I want to thank Minister Clark and Premier Ford, Minister Bethlenfalvy, the Finance Minister, and Transportation Minister Mulrooney for further funding commitments and for their ongoing cooperation as we work together to battle COVID-19. These commitments will cover more than half of the city's $649 million request for intergovernmental relief funding that we made in our 2021 budget. But we will need further funding from the other governments to address the remaining gap. We are working hard to secure agreement to 2021 Safe Restart funding from the other governments for all cities across Canada, including the City of Toronto. I am determined to secure this support. These ongoing discussions with both the Province of Ontario and the Government of Canada cover a number of areas of need, including, in particular, I will mention supportive housing and the ask that we have made in that respect to care better and more effectively and more efficiently for some of our most needy citizens. But the additional funding announced today and last week, less than a month after the approval of the City 2021 budget by the Council, and the requested support demonstrate that all governments are working together to protect services and to keep capital projects and jobs on track. The City and its hospital and healthcare partners have now administered more than 211,247 doses of vaccines to Torontonians, including thousands of Torontonians 80 years of age and older. The effort to get shots in arms is continuing today, with 22 clinics open across the city today. As you know, we will have enough vaccine supply next week from the Government of Canada and the Province of Ontario to open 3 of the city's mass immunization clinics at the Scarborough Town Centre, the Congress Centre in Etobicoke, and the downtown Metro Toronto Convention Centre. These sites will be vaccinating people 80 years of age and over starting on March 17th, 2 weeks earlier than planned, and the earlier schedule was set based on the anticipated receipt of supply of vaccine. Starting this Friday, approximately 133,000 individual appointments for people ages 80 years of age and over will be available, with appointment dates between March 17th, when we start with these mass immunization efforts, and April 11th for the 3 initial clinics. I know people are eager to get the vaccine, and we want them to be able to get it as soon as possible for as many people as the vaccine supply allows. Chief Pegg will have details on how people who qualify can register to get their vaccine at the city-run clinics. What's important to know for people 80 years of age and over is that this Friday you will be able to go to toronto.ca/COVID-19 to register for vaccinations to be offered at the mega sites in Scarborough, downtown, and in the northwest part of the city. I want to thank the Government of Ontario for working with us to get more vaccine supply, and for working so well with the city to make it possible for people to register for and schedule these important vaccination appointments. With predictable and large deliveries of doses expected over the coming weeks, as we outlined earlier on this week, I am confident that we will be able to start up the full suite of our vaccination efforts, including the remaining megasites, which are largely ready to open their doors, furnished and ready to go, pending confirmation of supply, and that's along with the many other community and mobile initiatives that we will use to help get Torontonians vaccinated. We won't stop, nor will our hospital and healthcare partners won't stop until everyone who wants their shot has received their shot. Today, I'm also proud to announce that as part of the city's efforts to ensure every resident in every corner of Toronto can access a vaccine, that the city has released a call for proposals for $5.5 million in funding to go out to Toronto's community services sector to fund community agencies who will act as local lead agencies for vaccination efforts in 140 different neighborhoods. This campaign is expected to play a very significant role in phases 2 and 3 of the provincial vaccine process as vaccine supply increases. Community-based, not-for-profit organizations have an important role in building vaccine confidence and helping all Torontonians to access vaccines. They are a key part of our overall Team Toronto effort when it comes to vaccines. You have the hospitals, you have the community agencies, you have the mega clinics, you have all of these people working together, including on a very local grassroots basis, including with our mobile efforts. And this work is all meant to increase access to vaccination. It is meant to get right to the grassroots, to have familiar faces in the community helping the residents of those communities to be fully informed as to the why, the when, and the where of vaccinations in their areas of the city. We want everyone to have access to vaccines and everyone to have all the information they need about vaccines so that they can make the right decision and get vaccinated. This work will build on Toronto's successful efforts to support provincial COVID-19 testing, for example, in hard-hit neighborhoods. This community mobilization and engagement campaign will be critical to ensuring that there is vaccine access right across the city. Through the call for proposals, the city is asking for expressions of interest from agencies with capacity and readiness to undertake the vaccine engagement work. Simply put, they will help us to help people make the right decision to get vaccinated, to inform them in advance of that, and then to actually help make it happen. Engagement lead agencies selected through the expression of interest will work collaboratively with the city and behavioral scientists to further develop coordinated engagement plans and to address gaps in reaching communities hardest hit by COVID-19 and the virus, and areas where there might be the greatest example of vaccine hesitancy. Plans will include door-to-door community vaccine outreach, multilingual communications to targeted populations, and facilitating easy access to vaccine clinics. The agencies selected through this process will develop a vaccine engagement team with anywhere from 4 to 10 members of those teams from community agencies that have the ability and have the experience of working with equity-seeking groups. They will reach out to groups across 140 neighborhoods, and further support will be offered to 280 community ambassadors that we talked about earlier this week, who will engage in outreach efforts as well. This is one more part of a comprehensive, well-thought-out overall plan to vaccinate 3 million people, to do it effectively, and to make sure that no one is left behind. The plan is comprehensive. It is founded on the social determinants of health, such as race and income and food security, housing and disability, so as to drive targeted equity action plans for the COVID-19 vaccine rollout. And it builds on the work of the city's COVID-19 Equity Action Plan and the TO Supports Plan adopted by the City Council in December of last year. I want people in our city, in every single part of our city, every nook and cranny without exception, to get vaccinated, because the sooner we are all vaccinated, the sooner we can move beyond this pandemic. We are all in this together, and we all need to get vaccinated together. The virus took lives, cost so many people their health, closed doors, cost businesses, and cost jobs. The vaccine will save lives. It will open doors, it will open businesses, and it will lead to what I am confident will be the greatest economic recovery in the history of our city. And on that note of hope, I would like to ask Chief Pegg to give his update, a very positive update indeed, from the Immunization Task Force.
Thank you, Mayor Tory. Before I begin my formal remarks today, I would like to acknowledge that it was 365 days ago today that we first activated our Emergency Operations Center in response to COVID-19. Our teams have worked since that time to plan for and respond to the COVID-19 pandemic as it has evolved and developed. I owe a huge debt of gratitude to each and every member of our team who continues to do their best to help us manage this emergency and to get to the point where we can return to all the things we miss so badly. Thank you, one and all. You continue to make us all very proud. As Mayor Tory announced earlier this week, on March 17, the following city-operated COVID-19 immunization clinics will begin initial vaccinations for Toronto residents who were born in 1941 or earlier: Metro Toronto Convention Centre, Scarborough Town Centre, and the Toronto Congress Centre. Beginning March 17th, these clinics will operate 7 days per week, from 11 a.m. through 8 p.m. daily. As you will recall, we were asked to bring the Metro Toronto Convention Centre clinic online in January as a proof of concept clinic. During the proof of concept operations, we had the opportunity to evaluate all aspects of clinic operations, including client registration and scheduling. As a result of unforeseen reductions in vaccine availability, operations at the initial proof of concept clinic were suspended after 2 days. In February, we again brought this proof of concept clinic online in order to administer the second doses of vaccine for those who received their first dose in the clinic in January. During the earlier proof of concept operations, we worked with the Province of Ontario to pilot the developing provincial booking system. The complete provincial booking system will be fully deployed across Ontario on March 15th. In order to avoid delaying the upcoming launch of city-run clinic operations, I'm very pleased to advise that we have worked with our provincial partners to make it possible for eligible Toronto residents who are 80 years of age or older to schedule their vaccine appointments by leveraging the provincial booking system framework prior to the full system going live on March 15th. Beginning on the morning of March 12th, the province will once again bring our initial clinics onto the ongoing booking system pilot, such that eligible residents will be able to schedule their appointments for vaccination without delay. This builds upon our previous proof of concept operations, completed in collaboration with the Province of Ontario. I want to thank our provincial partners for making it possible for this to happen ahead of the full system going live on March 15th. These 3 clinics are opening 2 weeks ahead of schedule and in direct response to increased vaccine availability. Approximately 133,000 first dose appointments will be available in the booking system between March 17 and April 11 across the 3 initial clinics. This is in addition to the associated second dose appointments that will also be scheduled. Additional appointments will become available in the system after March 15th as we continue to expand clinic operations in response to the availability of COVID-19 vaccine. This achieves 2 important and shared goals. Firstly, this allows Toronto residents born in 1941 or earlier to schedule their COVID-19 vaccine appointment in one of the 3 upcoming City of Toronto operated clinic locations without having to delay the commencement of those clinics. Secondly, this allows us to introduce a larger volume of registration and scheduling traffic online within the provincial system in a methodical manner ahead of the launch of the full system on March 15th. While the call center functionality that forms part of the full provincial booking system will not be available until March 15th, eligible Toronto residents will be able to book their vaccination appointments online beginning March 12th. When the system goes online on March 12th, eligible residents will be able to access the booking system by going to toronto.ca/COVID-19 and clicking on a registration button that will be prominent on the city's website, taking you into the registration system where your eligibility for vaccination will be confirmed. You will need to enter the following information as part of the booking process: the information found on your Ontario Photo Health Card, your birth date, your postal code, and your email address and/or phone number. The provincial system will verify your eligibility to book an appointment for vaccination based on this information and will then take you to the scheduling system. You will then be able to enter your postal code to find the closest available clinic location, or you can choose to scroll through all the available appointment options. You will be able to see all of the available appointment dates and times, and will be able to select the available appointment that you prefer. You are free to select whichever available appointment date and time in whichever clinic you choose. Once you select and confirm your first dose appointment, you will be asked to select the date and time for your second dose appointment. Once you have selected and confirmed both your first and second dose appointments, you will receive a confirmation number and a QR code as a confirmation of booking. Your confirmed appointment information will also be sent to you via the contact information you entered when booking your appointment. Eligible residents are permitted to have another person book an appointment for them if they choose. You will not need to bring this information with you to the clinic on the day of your appointment if you would prefer not to, as our clinic staff will be able to locate your appointment in the COVAX system by looking up your information when you arrive on your scheduled date and time. The system will not permit anyone to schedule multiple appointments. You will only be able to schedule one set of first and second dose appointments per person. As a reminder, the call center functionality that will be included with the full provincial booking system will not be available until the full system comes online on March 15th. We estimate that on average, you should expect to be inside a city-operated immunization clinic for approximately 30 minutes, from the time you begin the screening and check-in process until you are vaccinated and have completed the after-vaccination observation and care process. As soon as additional vaccine supply permits, we will bring additional clinics online, with the goal of having all 9 of our city-operated clinics up and running as very soon as possible. Once all 9 clinics are up and running at planned capacity, we will be able to administer more than 500,000 doses of COVID-19 vaccines monthly in the city-operated mass immunization clinics alone. In addition to the 9 city-operated clinics, more than 350 additional clinics are planned across the city, including clinics operated by hospitals, Ontario healthcare teams, community healthcare partners, and pharmacies. Also, as soon as vaccine permits, primary care providers and family doctors will also be able to administer COVID-19 vaccine. This is truly a Team Toronto effort, with all of the partners working together to get us all vaccinated as soon as possible. I want to be clear that only Toronto residents who were born in 1941 or earlier will be able to book appointments at this time. In order to avoid placing unnecessary loading on the booking system, we ask those who do not meet those eligibility criteria to avoid trying to access the online booking system until such time as you are eligible for vaccine. This will help to ensure an efficient and effective booking process for everyone as we move forward. If you already have a confirmed vaccine appointment in a hospital-operated or healthcare partner-operated clinic, you do not need to schedule anything further, as your appointment remains confirmed. However, if you choose to book an appointment in one of the city-operated clinics, please be sure to cancel your other appointment in order to avoid missed appointments so that as many people as possible are able to receive their vaccine as quickly as possible. If you choose not to book an appointment when the booking system opens, or you are unable to book your appointment for any reason, rest assured your opportunity to book your appointment will continue. Once you are eligible for vaccination under the Provincial Vaccine Priority Framework, you remain eligible continuously thereafter. I'm asking for the assistance of all Toronto residents in not calling 311 nor Toronto Public Health for assistance with booking COVID-19 vaccine appointments. Our 311 and TPH staff do not have access to the provincial booking system and are not able to assist with booking COVID-19 vaccination appointments. After March 15th, the provincial booking call center will be available by phone. Finally, please remember that vaccine is not available in city-operated immunization clinics without a confirmed appointment. Please help us maintain effective clinic loading by not coming to a clinic unless you have a confirmed appointment. I thank everyone in advance for their continued patience and cooperation, and please continue to monitor toronto.ca/COVID-19 for the most up-to-date information on immunizations in Toronto. Thank you. I will now invite Dr. de Villa to bring her remarks.
Thank you, Chief Pegg, and good afternoon. Today, I am reporting 473 new cases of COVID-19. 264 people are in hospital, and 53 people are in the ICU. I'm sorry to have to report an additional 4 deaths today. You've just heard from the Chief about clinics that the city is going to be operating starting next week. And today, our hospital and healthcare partners are working to operate approximately 22 clinics to vaccinate priority groups throughout the city. So while we are doing everything possible to vaccinate Toronto as quickly as possible, I want to thank Torontonians for continuing to follow public health advice and urge you to continue doing so. These steps for self-protection are as important as ever as we continue to see concerning growth in cases with variants of concern, which spread more easily and cause more severe illness. To date, 2,327 cases have screened positive for mutations. The majority of confirmed variants continue to be the highly infectious B.1.1.7 variant, also known as the UK variant. There remains a real risk that we will begin to see an increase in COVID-19 cases over the coming days and weeks. The best way to prevent this increase is to stay at home whenever possible. Reducing the number of interactions we have with one another reduces the virus's ability to spread. Take care to keep distance between yourself and others not in your household, especially when you are indoors. These measures will reduce your risk of contracting and spreading any version of COVID-19. Tomorrow will be the 1-year anniversary of the World Health Organization declaring COVID-19 a pandemic. This anniversary coincides with a sobering milestone here in Toronto. We have now passed a total of 100,000 cases. The exact figure today is 100,897, and I would remind you again that the death toll is 2,699 people. We talk of exponential growth. Perhaps we can think for a moment in terms of exponential loss and suffering, because there is no way to fully account for the number of family and friends that one life connects with. So many have lost loved ones to COVID-19, have fallen ill with the virus, and have had their livelihoods affected. I want to acknowledge this because while most of us are still here, the last year has been one of extraordinary challenge as our lives were uprooted. I particularly want to thank my team at Toronto Public Health. Like all of us, they live with the threat of COVID-19. Their work revolves around the virus again and again, all day, every day. And given the significance of the response required, it is common for people at Toronto Public Health to work 10 and 12-hour days, 7 days a week. Because of the pandemic, Many of them find themselves doing jobs entirely outside of their regular work. Nonetheless, I have seen them take up the work and press through it, past the point of exhaustion, in the face of relentless demands and scrutiny, and now under the pressure to deliver vaccinations through all the channels we are speaking about. Public health is the work they wanted to do as a career, but the demands are above and beyond almost every working minute, and I cannot thank them enough for taking up the challenge for all the people who call Toronto home. In all this, we see the resolve and the resilience of all Torontonians. We have learned a lot about ourselves as individuals and as members of our communities, about what we truly value and what really matters. Things like personal connections, such as a warm embrace from a loved one, or a meal with family and friends. And in many cases, we've learned how much we miss not things, but people and experiences. It is heartening then to realize how close we are getting to having those things back, which is why all of us at Toronto Public Health are committed to rolling out the vaccine as quickly as possible. As we do so, we continue to ask you to stay home, and when you leave the house, to wear a mask and to practice physical distancing. This will help us combat the increases we're seeing in variants of concern and will help us to protect those who are not yet vaccinated. A lot has been asked of you in the past year. The truth is, more will be asked of you yet, but it is in order to move beyond a past in which we had little choice, toward the future we all want. With that, I'll now turn it over to Lavin so we can take some questions.
Thank you, Dr. de Villa, Mayor Tory, and Chief Pegg. We'll now start the media Q&A. As a reminder, it's one question, one follow-up, and please unmute yourself when you're called upon. First up, we have Dave Woodward from 640. Go ahead, Dave.
Thank you very much. Mayor Tory, you said this morning you were hopeful we could be moving into the red zone before too long. But looking at the numbers, it appears that Toronto is still pretty far off of the threshold to move out of the gray lockdown and into the red control zone. So my question is, are you considering changing the criteria you look at before asking to be moved into the red? And if so, how will that be determined?
Well, in the end, the thresholds that determine what category you're in under the provincial framework are set as part of the framework itself. So there is a threshold for going into red that is there now. And I would just say that we're having continuous discussions, as we will continue to do, that focus on, yes, the health numbers, which are obviously very important, but also on the psychology of people, also on the regional context and what's going on in all the areas around us, because that has an impact. And then last but certainly not least, the state of the economy and the considerations we have to take into account in terms of the well-being of people overall. So we'll continue to have those discussions. The framework is what it is. We make a recommendation to the province and they will decide, and we'll look forward to having the very intense phase of those discussions, probably not until early next week.
Okay, thank you. My next question for Dr. de Villa. New StatScan numbers that came out today suggest the majority of excess deaths during the second wave didn't come from older Canadians, but from younger ones, and suggested that it was indirect effects of measures used to battle the pandemic as the cause. So does that make you think twice about the measures that we're putting in place now?
You know, I think we're constantly evaluating, our measures, the actions that we take, and the impact that we're having in terms of controlling COVID-19 and any other impacts associated with those measures taken. That's simply responsible public health practice. But I would say this, every action that we have taken has been guided by the best available science, by the data we see on the ground, and certainly has all been with the clear objectives in mind of reducing the negative impact of COVID-19, saving lives in particular, ensuring that we protect our healthcare system, and trying to protect our society as well from the broader health and social impacts related to the COVID-19 pandemic. So we will continue to do that on an ongoing basis. We'll continue to study those numbers, and we'll adjust our actions in accordance with those numbers.
Next up, we have Natalie Johnson from CTV. Go ahead.
Hi, everyone. I think I heard you say that when people are able to book on the city site for a mass immunization clinic beginning this Friday, they'll also be able to book the second dose appointment. I'm just curious what dosing interval you're planning for that.
Thank you. Yes, you're correct. In fact, not only will someone have an opportunity to book their second dose appointment, when someone accesses the booking system and books their first dose in a city-operated clinic, they will be required, as a functionality of the system, to book their second appointment at the same time. That is, those parameters have been set in the system in accordance with the provincial dosing provisions that have been set out for us, and my understanding is that that is based on an interval of 110 days plus or minus 5 days, if I understand that correctly.
Thanks very much.
Natalie?
That's good for me. Thanks.
Okay, thanks. And then next up, we have Denise Pegg-Lewan from Canadian Press. Go ahead.
Hi, thank you for taking my question. The Ontario government announced today Toronto will be part of this initiative of having doctors contact patients to book appointments. And this is for the Oxford AstraZeneca vaccine. I'm wondering if you can information about this.
So I'm sorry,
Toronto.
Denise. I think you were asking for specific information about the AstraZeneca pilot with primary care providers in Toronto.
Yes, so for residents 60 years old to 64 years old.
Yes, so this is one of the many new programs that's being announced. It is in its early phase. It's a pilot project and undertaking. Again, our goal has been to try to work with all of our partners, our provincial government partners, community partners, healthcare partners, hospital, all players involved in vaccination administration to ensure that there are as many options as possible to provide vaccine to the residents of Toronto in as efficient and effective a manner as is possible. So this is a new announcement. I believe that there are a number of particular primary care practices who are engaged in this pilot undertaking. They will be providing that AstraZeneca vaccine to a select number of patients to whom they will be offering that vaccine. And you're quite right, Denise, they are in that age group 60 to 64 years of age. So we'll look forward to seeing how that pilot unfolds, learn from it, and from there, hopefully expand efforts with vaccine administration so that we can achieve that goal of vaccinating as many Torontonians as quickly as possible in the most efficient way as is possible.
Thank you so much, Dr. de Villa. And just a follow-up on that, Mississauga Mayor Crombie actually tweeted that they will have 8 primary care providers, partners who will administer this. I'm wondering if Toronto has a number for how many offices or sites you're planning to do for this.
So I believe this is something that was negotiated between the province and certain primary care providers. If I have my numbers correct, I believe it's 11 primary care practices that will be participating in this pilot to start off with. But hopefully we'll see that number grow thereafter.
Next up, we have Matt Bingley from Global. Go ahead, Matt.
Hi, good afternoon. My question is for Chief Pegg. Just in relation to the use of the Provincial website. I'm just wondering if you can take me through the genesis of how this actually worked and how you've been testing it, and what concerns, we've seen in BC, and also repeated warnings from the province today, repeated warnings about the threat of the website crashing due to demand. I'm just wondering what assurances you've received that we're not just being set up for failure here.
Sure, thank you. So the genesis of where we are today and where we will be beginning on the 12th actually date back all the way back into late December, and then of course culminating with early January, when the province of Ontario asked the City of Toronto to accelerate the opening of the first clinic under a proof of concept operation, and that, of course, that was at Metro Toronto Convention Centre. So during the course of those operations, we were also asked to evaluate all aspects of clinic operations, including scheduling, and we undertook that. That, of course, ended before any of us would have preferred to see it, ended after 2 days as a result of a shortage of vaccine. But we brought the clinic back online and stood the proof of concept back up in February again, assessing clinic operations and assessing the scheduling and the COVAX system that runs for managing all aspects of clinic operations. As a result of that experience, Matt, we were able to provide some very significant feedback back to the province, and it became very clear at that point in time to us, based on the size and scope and complexity of operating this type of operation in a city as big and complex as Toronto, that the only recipe for success, if you will, is to operate on the basis of one centrally coordinated booking system. And of course, that is exactly what the development of that is what has transpired. We have been in regular contact with them and in contact throughout. And while I can tell you that, and with my deep appreciation, the province has accelerated, as have we. We've all accelerated to launch these clinics 2 weeks early. The province has matched that and are bringing us back on that proof of concept. We heard General Hillier say earlier this afternoon, acknowledging that this is an unprecedented, we've used that word a lot, this is an unprecedented lift in all aspects of managing the COVID-19 pandemic, and unprecedented from the standpoint of the amount of resources that need to be coordinated, and then more directly to your question, the amount of resources and the functionality that needs to be effectively managed and withstood by any system. The process, I have every confidence. I know that the process engineers have evaluated fully. It has been tested to the full extent that it can. And I'm excited about the fact that bringing us back onto the proof of concept now allows us to introduce increased demand, increased loading onto the system, which is going to be very beneficial, not only for our use, but for observation and evaluation and the consideration of our provincial partners as we all move towards March the 15th. So I commend them. They have certainly my thanks and the thanks of our entire city for bringing us back onto the proof of concept, and I'm eagerly awaiting the launch or the arrival of March the 12th and getting us through to the commencement of our next set of clinic operations.
Could I just clarify before I ask my second question, was the booking system that you were using in January and February, was that the same website that you'll be using on Friday?
Not exactly. So of course, at that point in time, the booking system was still being developed. It was based on the same foundation and of course directly connected and feeding into the COVAX system, which is the overarching platform. In January, we were testing, I would say, various versions and various different functionalities that continued in February, and all of that has resulted in the refinement and the final decision and launch, imminent launch of the provincial booking system, which we've had the opportunity to be walked through what that functionality is, Dr. de Villa and I, as recently as last night. And I can tell you it looks fantastic. I'm really excited about the functionality. It appears to me to be very intuitive and a very seamless, means of moving through the process. And based on what I've seen, I'm confident that it's going to meet our needs. Okay,
I'll keep this one really, really quick. I'm just wondering how long you're planning on actually using the city portal to guide people there, and if just for simplicity for people who are in that demographic, if you might think about just actually keeping that tab just to guide people to the right spot.
I would say that's a distinct possibility, Matt, and we're working with all of our communications professionals, and certainly led by strategic communications here for that very purpose. So one of the things that we will evaluate over the next number of days is the customer experience, if you will, and that access. And I can tell you that we have a team of people right now working on making sure and doing everything we can do to make this as seamless, as streamlined, and as clear a process as possible. So I would say nothing has been determined, nothing is off the table, and we're certainly looking at every option to make it as seamless and as easy as possible.
Next up, we have Ali Chasson from CBC. Go ahead.
Thanks for this. It does seem like we are on the cusp of a third wave, considering where our numbers are and how we now have a field hospital being built to accommodate at Sunnybrook. I'm wondering what else the city is doing to prevent a third wave and whether we realistically still can.
So I think that's an excellent question to ask. I think we're looking at variants of concern. We do see numbers and indicators that are unfortunately showing that there is still very much a real risk associated with COVID-19 and a surge in cases. This has certainly been the experience in other jurisdictions. But I take heart in two things. One, even with variants of concern, we know that distance works. So the self-protection measures that you've heard me speak about for now many, many months, if not the last year or so, they actually do work. So to the extent that Torontonians can continue to stand behind those measures and practice those measures, we actually have a great deal of power within our own hands to control the situation. We've seen Torontonians do this before. I know it's tough. It's been a long, long year, but just a little bit more, and we can actually see hope on the horizon. That brings me to my second point. We've been talking about now, for the last several minutes, the promise of vaccine and the ability to roll that out in multiple venues, the most prominent of which we've just spoken has to do with mass immunization clinics that the city is undertaking, just a few short days away. And we know that the vaccines are incredibly effective. I've spoken about what we have seen within the context of our long-term care homes and our retirement homes, where vaccines have been delivered and have had the opportunity to provide their effect. We've seen the same effect in other jurisdictions all around the world. These are very effective vaccines. So, taking those two things together, I think we still have much opportunity and power to control our own future. It is very much in our hands. And I would just encourage people to continue to practice those self-protection measures, to get the vaccine as soon as their turn becomes available. And then we can all get back to the kinds of lives that we would like to return to, or at least life a little bit more like it was before COVID-19 became part of our lives.
Okay, thank you very much. My follow-up question is actually for my colleague Greg Ross, who's working on the shelter funding story. Mayor Tory, I know you touched on this at the beginning, but can you provide any more specifics on how the $94 million will be spent specifically to prevent shelter outbreaks?
Well, it really just finances our overall efforts with respect to shelters, and the number one way in which we have tried to prevent and minimize outbreaks is through distancing, like Dr. de Villa said. So that has involved thousands of people, literally thousands of people over the course of the pandemic, and it continues up to this day, to be moved into other facilities, including hotels, because there were only so many shelter spaces we had available, in order to make sure that they could keep distance from one another that would minimize the spread of the disease. And we've furthermore gone into now looking at Toronto Community Housing Suites and other kinds of things that are going to allow us to accommodate people in a proper manner with proper supports, but also to be distanced from one another. So really, the provincial money is helping to compensate us for those kinds of expenses, as well as things like PPE and disinfection and other expenses we've been put to as a result of being in pandemic times. And it will be very well used in that regard, and is still very much needed because the responsibility to do that and to keep people properly distanced and safe is still upon us with regard to the people experiencing homelessness.
Next up, we have Scott Lightfoot from CTV. Go ahead.
Thanks, Levin. Question for Dr. de Villa. This is the first of hopefully many nice days as we enter spring and summer. Right now, the public health guidelines say to people that if they're going outside, do so by yourself or with people from your own household. I'm wondering if there are any plans to adjust that to allow for some outdoor socialization if people follow the given protocols that we've been told for the past year. I know in BC yesterday, they said as early as this weekend, they might suggesting that people feel comfortable to visit with family or friends outdoors, provided they follow those distancing guidelines, masking protocols and such.
So I certainly think that that's a possibility, and I would imagine that that's a subject of conversation at provincial tables. Again, that kind of advice is probably best proffered at a provincial level rather than, you know, having different guidance occurring at different jurisdictions locally. I would say this, though. No question. The risk of transmission of disease is certainly lower when we're talking about outdoor space, but it's not zero. So by all means, it is definitely safer within the outdoor environment. It is a safer place for sure to socialize in respect of reducing the risk of COVID-19 transmission. It does not bring the risk down to zero, of course, and the best thing to do for now is to continue to maintain that distance as much as possible, particularly when we're talking about interactions with people with whom you don't live. Wear your mask as much as possible, wash your hands, you know, all the good self-protection measures. They're really, really important at this point in time. And finally, when your opportunity comes to get vaccine, please go and get that vaccine as soon as you are able. All these actions taken together are the elements that will get us to the other side of this pandemic and to a life more like the one we used to know.
And just to follow up on that, you mentioned the vaccine thing. By this spring and summer, the majority of people will not have had access to the vaccine. So do you predict that this spring and summer will be very similar to last spring and summer? Or do you think that given what we now know a year into this, that perhaps the guidelines could be a bit different, or perhaps you would take a harm reduction approach rather than telling people not to do things outdoors, not to gather outdoors, just to sort of do it in a safer way?
Well, you know, I think within the realm of public health practice, we're always trying to do what makes the most sense based on the evidence and the available data. But we also have to recognize that, you know, we are at a different point. And as the mayor has commented, the psychology of the people is very different, you know, now over a year into the pandemic relative to where we were last summer. So, you know, I'm hoping that as vaccine supply becomes more available and as those of us around the province who are now able to start vaccinating members of our communities in larger numbers, that we're able to really ramp up those operations and get vaccine into arms as quickly as possible. So, you know, the real hope is that we get vaccine out quickly, that we have a good summer, that nice weather comes so that allows us to be able to enjoy the outdoors, and hopefully we will start to see life look a little bit more like it used to in the past.
Next up, we have Francine Copin from the Toronto Star. Go ahead.
Good afternoon. My first question is for Mayor Tory. When you talk about bringing Toronto into the red zone, what kind of timeline do you have in mind?
Well, I have deliberately stayed away from naming timelines because I think what you don't want to do is create expectations that won't be fulfilled, and you don't want people to be taking steps, say, in businesses to be buying things or calling staff back on the expectation a certain date is going to be met. My answer would be as soon as possible, and it's why I've said repeatedly we have these discussions on a continuous basis, and I think it is important, provided the health numbers give us a foundation to work with, that we keep moving forward in a positive direction because of the psychology of the people, because of the regional considerations we have, because of the economy, but obviously driven principally by the state of the healthcare and health situation. And so those discussions are going on continuously, and the answer is as soon as possible. And I think that we'll as I said, probably be intensively discussing that into next week, because that will mark a 2-week point. But I don't think a 2-week point is definitive one way or the other, sooner or later. But it'll be as soon as possible.
Thank you. My second question is for Dr. de Villa. If we should find ourselves in a third wave, will we have to look at closing businesses again?
Francine, I will tell you this. We will do everything we can to avert a third wave. I think that's our commitment to the people of Toronto, and my ask of the people of Toronto is to also participate in their very best efforts to continue to practice the self-protection measures and to keep distance, to wear their masks as much as possible, to wash their hands, all the good measures we know that reduce the spread of COVID-19. I think if we all do that together and allow for vaccines to roll out and have their impact, that's the very, very best that we can do to avert and avoid a third wave. What measures might be required, I think will all be determined on what we see, by what we see, I should say, on the ground. I don't want to commit to a particular course of action or a set of actions. I think we're very much learning. This is a unique phase of the pandemic. It'll be interesting to see what other jurisdictions around the world are doing themselves. We have committed to apply the best available science and the local data in order to inform our decisions. We'll continue to do that. So, Francine, my plea and my first choice is to do the best we can with the actions that we know work in order to avoid that very difficult situation in the first place.
Next up, we have Tina Yazdani from City News. Go ahead, Tina.
Hi, thanks for taking my questions. The mayor mentioned earlier that thousands of shots have gone into the arms of 80 and older residents. Do we know how many thousand? And also, what do you say to residents who are frustrated that they're seeing other regions getting the shot like by the thousands into the 80+ population, but here in Toronto, it just feels like this city is falling behind?
So at last count, I don't know that I can give you an exact figure, but I can say that it's certainly over 30,000 80-plus-year-olds who've been vaccinated in Toronto to date. And with the announcement of the clinics that we've provided for, I expect that number will go up quickly, and it continues to grow because there are people within that age group who continue to be vaccinated with the available supply through our hospital and healthcare system partners. The issue for now has been one of vaccine supply. So the kinds of announcements that you've heard us talk about today are announcements that can be made in respect of standing up mass immunization clinics now that a more stable and more voluminous supply of vaccine has been announced and made available. So I can't tell you enough how much we're looking forward to being able to vaccinate our residents, starting off with those who are 80 plus years old, but then to continue on to vaccinate the rest of the population as soon as is possible.
And can you clarify why the city is waiting another week to open those clinics? I know it's a supply issue, but my understanding is that shipments are coming in this weekend. So why do we need to wait until the 17th? Why not just get those clinics up and running? Is it a logistical issue, or if you could just clarify?
I will make the dangerous move of speaking on behalf of the chief. But as I understand it, we're not actually expecting the supply for, that allows us the opportunity to operate the clinics until early next week. Hence, we're starting the clinics on the 17th. You want to make sure that you actually have vaccine. I mean, this is the fundamental for a mass immunization clinic. We're set up, ready to go. What we need is vaccine, and we'll look forward to receiving that vaccine so we can start operations there once we're sure that we have that supply available.
And our last question goes to Nick from CBC. Go ahead, Nick.
Thanks. For Chief Pegg, please. Do you have an update yet about when we could move to a 24-hour schedule at some of these clinics?
Thank you, Nick. The update is really as it has been really from the start, and that means we are in the early stages now of standing up our network of what will ultimately be 9 City of Toronto operated immunization clinics. We're opening the first 3. Our goal shortly thereafter, as very soon as vaccine availability permits, will be to open the remaining 6. And then, again, all consistent with available vaccine, to scale up the operation of each one of those clinics until we're running at maximum, the maximum what we call throughput, or the maximum capacity of each clinic. When we are at that point, we will be delivering in the city-operated clinics roughly 500,000 doses every month. At that point in time, once we're at all 9 clinics open and operating at maximum capacity, then we will be at the point where having the conversation and initiating the conversation with our Immunization Task Force Command Team about expanded hours of operation and potentially transitioning to 24-hour operations, it makes sense at that point. Until such time as we have all 9 clinics operating around the city, providing as equal and open access to all of our residents as we can possibly do, those discussions would be premature. So we're still in the process of getting going. Like I say, at the point when we're 9 clinics operating at full planned capacity, that's the point we need to have those conversations.
Okay, understood. But maybe if we can just sort of imagine that possibility a little bit more, can you explain how it is that you think operating a clinic 24 hours a day would help the city's vaccination efforts? Who are the types of, is it essential workers, frontline workers who you envision going to one of those in the middle of the night or something? Can you just describe how you think those will help the effort?
Sure. So, I mean, of course, the concept or principle of 24-hour operations is something that is it is certainly the opposite of a foreign concept to me. I have spent nearly 30 years of my life working in and managing 24-hour operations, so something that's very comfortable with, for me and that I'm very comfortable speaking about. The time that we would consider going to 24-hour and the rationale for doing that would be simply because we now have the available vaccine and the available client demand in order to justify making more and more and more and more vaccine available. So it's really about expanding the available capacity of the clinic. Yes, of course, it would potentially expand or I guess you could say add additional availability through the overnight period as well. But really it is a function of expanded capacity. And like we have talked about from the very start, when we started to plan our mass immunization clinic strategy, we built things like scalability of clinics and built in the plans to potentially and understand how we would or could expand those hours of operation. It could be into different hours, it could be staggering hours, it could be moving into operating overnight. All of those I would say are possible, but the conditions are we would need the sustained and reliable availability of vaccine to make it happen, and we would need to know that there is a drive and an interest and a need from a public and a client perspective, which I'm sure there would be. So it's about getting us fully scaled, getting to the point where we have the vaccine we need to deliver at an even greater level, and I can assure you nothing will make me happier than to go to the Immunization Task Force and say that we have hit our max capacity within our immunization clinics, there's more vaccine available, and we now need to figure out how we're going to expand. That will be a good day for me.
That's it for today. Oh yeah, go ahead, Mayor.
I just wanted to go back, if I could, to Tina's question before and make something perfectly clear. If you'd gone a week ago, or even more than a week ago, to the majority, if close to all of our proposed mega immunization sites, and you'd looked in the window, you would have seen those places were furnished and ready to go. They were not staffed at that time in terms of people sitting there, because that makes no sense, but the staff was largely in place. And so we were awaiting supply, and the only reason they're not opening sooner than they are is because they're opening within a day of when we anticipate the supply to be actually delivered to us based on what the province says. In the meantime, today, we have 22 clinics operating across the province of all different kinds. We have vaccinated 211,000 people, including thousands of people over the age of 80. But remember one more thing. We had to, before we got to some of those people, vaccinate thousands upon thousands of people under the provincially dictated priority framework, which includes frontline healthcare workers, long-term care residents, and properly so. But we had far more of those people we had to do in the City of Toronto with the available supply before we could even think of moving to the 80-plus population, for example, under the provincial list. And so we just didn't have the supply to do more than that. Otherwise, we would have opened these mega clinics sooner because they were ready to open. And so we'll now open them. It's going to be a happy day next week, and we can get on with this, not to mention what's going on already at the 22 clinics today. Thank
Okay,
you.
that's it for today, everybody. Thank you for coming. Our next update will be on Monday, March 15th. Have a good rest of your week.